Since the start of the COVID-19 outbreak in Guyana, which is nearing 2 years, a total of 15 children who tested positive have died. At the weekend, health authorities reported that 4 children, including 2 boys ages 3 years and 14 months from regions 4 and 1 respectively, succumbed to the disease. In addition, a 3-month-old baby girl from region 4 and another 6-year-old from region 3 were also added to the death toll. While young children make up a very small portion of the COVID-19 deaths countrywide, in the majority of the recent cases, the children died during transit to the hospital. Health Minister Dr. Frank Anthony, during his COVID-19 briefing on Monday, said that in questioning the parents, health authorities were able to ascertain that the children were experiencing COVID-19 related symptoms such as fever and difficulty breathing while at home. He said that an investigation is underway by a small committee of doctors to garner additional information surrounding the deaths of the children.
Of the 4, 3 of these children arrived at the hospital. They were dead before arrival to the hospital, so they didn't die in the hospital. So by the time the parent brought the child to the hospital, the child had already died. So we have had, so that's why we have to investigate these cases.
The minister divulged that some of the children had existing underlying health conditions, which were compounded by the COVID-19 diagnosis. In the past, the health ministry reported that children who would have succumbed from COVID-19 were cancer patients. Meanwhile, the COVID-19 phenomenon continues to worsen all across Guyana with spiraling COVID-19 infections. 11,494 persons are currently COVID-19 positive, while 128 are being treated and monitored at the hospitals. 15 patients are said to be in the intensive care unit. Vaccination numbers show that 417,714 persons have accessed the first dose of a COVID-19 vaccine and 304,403 have been fully immunized. Health authorities continue to encourage the populace to also access the booster shots, which they say can offer extra protection against COVID-19 variants, particularly Omicron, which is suspected to be circulating in Guyana currently. The country has also received another tranche of in excess of 28,000 doses of the Johnson & Johnson vaccine through the COVAX mechanism. The Johnson & Johnson vaccines are being offered as boosters for recipients of the Sputnik vaccine. The heartbreaking story of a Region 1 Barima-Winey father being forced to carry his 14-month-old child who died of COVID-19 to the cemetery on his shoulder after the designated vehicle was not available at the time surfaced on social media at the weekend. Dr. Anthony offered an apology to the affected family while noting that measures will be taken to avoid a recurrence.
There is a vehicle that operates between the police and the Ministry of Health, and so somebody ought to have assisted the family in getting the body to the cemetery or to the site of burial.
Temika Rodney reporting for the HGP Nightly News.